This is a case presentation of a basic and common spine operation, namely microdiscectomy for treatment of symptomatic herniated disc. Patient is a 40-plus-year-old man who presented to the emergency room with 2 months history of severe low back pain with radiation to the left leg. On physical examination, he had weakness of a left lower extremity with ankle dorsiflexion approximately 4 out of 5. MRI of his lumbar spine revealed a large herniated disc at L4-L5 level with complete effacement of the thecal sac. Let's briefly go over the simple anatomy here. You're looking at the sagittal MRI of lumbar spine T2 sequences. Let's count the vertebral bodies. Can you see the large herniated disc? Here in red, you see a large herniated disc directly from L4-L5 disc space and into the spinal canal. What are the surgical indications here? Well, number 1, he has weakness of his leg, namely weakness of left ankle dorsiflexion. Number 2, his pain is intolerable. And lastly, he does have a very large herniated disc. As a result, he was indicated for surgical resection of this disc. Let's go through this basic operation. You're looking through the surgical microscope, and everything is magnified. And approximately an inch incision is enough to expose the lamina and spinous process of L4. Here's the top, medial aspect of L4 lamina and spinous process. High-speed pneumatic drill is used to thin a portion of L4 lamina. This portion is carefully separated from the underlying ligamentous flavum, which is draped over the spine or thecal sac using an up-angle curette. Next, kerosene rongeur is carefully used to remove the thinned lamina. Underlying ligamentous flavum is carefully dissected and removed, exposing the underlying L5 nerve root and thecal sac. I find Penfield 4 quite useful for this. You can see the L5 nerve root here pushed posteriorly by the disc. The nerve root being pressed by large herniated disc is carefully retracted medially using a nerve root retractor and therefore exposing the underlying disc. Ideally, we like to gently pull the entire disc fragment off in one piece. After exposing the disc fragment, number 11 blade is used to make an incision over the disc fragment capsule. Next, using an angled instrument, we try to separate the disc fragment from the original disc. This disc was found to be calcified and adherent, so instead it was removed meticulously in piecemeal fashion, relieving the pressure on the nerve root. Of note, pituitary rongeur is a very dangerous instrument, as it can pull critical structures such as the edge of the dura or nerve root and should be used very carefully, with the tip always observed during use. This large disc fragment was finally removed in small pieces and the nerve root completely free and unhindered. This finalizes the basic review of this very basic operation in neurosurgery.